My name is Darren Kies. I'm an interventional radiologist. I'm the chief of interventional radiology for a private practice group called Piedmont South Imaging, and we provide services to Piedmont Fayette Hospital and Piedmont Noonan Hospital in the south and southwest metropolitan area of Atlanta. A percutaneous lung biopsy is a procedure, a minimally invasive procedure performed to sample tissue from the lung. Usually that tissue is something that your provider is concerned could be a cancer. The procedure is performed by an interventional radiologist, and it is done using imaging guidance. So what that means is typically a CT scanner is used to visualize a needle as it is advanced through your skin towards the nodule or mass in your lung that we're attempting to biopsy. This procedure is typically done on an outpatient basis in a radiology center inside a hospital. Usually this is something that you get sedation for during the procedure. So usually you can't have anything to eat or drink after midnight, the night before the exam. And you come in that morning, you have to have an IV started, and you get some medicine through that IV before the procedure to kind of help you be calm and relax for the procedure. And the medicine given during the procedure makes it such that you're not very concerned about what's going on, but you're still breathing on your own. It's not general anesthesia. Usually depending on where the nodule is in your lung, you're either going to be laying on your back, sometimes on your stomach, sometimes on your side, whatever's easiest for the radiologist performing the procedure. And usually you will feel a little bit of sting and burn when we give some local numbing medicine. But other than that, patients are typically very comfortable during a percutaneous lung biopsy. The procedure itself, once the physician gets started, takes anywhere from 10 to 15 minutes, depending on the complexity of the biopsy procedure. During the procedure, the one thing that I always warn patients about is it is not uncommon to start to cough when a lung biopsy procedure is done. And sometimes you can cough up blood during a procedure. That's something called hemoptysis. And that can be very disconcerting for someone if you don't warn them beforehand. And it happens not every time, but often enough that I've warned all patients about it. And it's usually self-limited and resolves on its own. Other things that you need to know about a percutaneous lung biopsy, just like any invasive procedure, is there are risks involved with these types of procedures. Standard risks, anytime you poke someone with a needle, you always talk about the risk of bleeding and the risk of infection. This is a sterile procedure, and you don't typically receive prophylactic antibiotics for this. So the infection risk is quite low. It's done using sterile technique in a sterile environment. The risk of bleeding, we've already talked about the bleeding that you can get when you cough up blood, but there's also a chance that you can bleed in the soft tissues where the needle enters the skin or into the space lining the lungs. This risk is actually quite low, and the chances of you having a bleeding complication that would lead to a hospitalization is exceedingly low, less than a fraction of a percent. The biggest risk with lung biopsy is the leakage of air from the lungs. And when that air collects around the lung, it's something called a pneumothorax. Now, a pneumothorax is actually relatively common after a lung biopsy. Upwards of 20 to 40% of patients can have a pneumothorax after a lung biopsy. The real question with the pneumothorax is how big is it, and is the patient symptomatic? Most small pneumothoraces will resolve on their own, and they don't require any further management, and they don't preclude you from going home after your biopsy procedure. If a pneumothorax is large in size, or if the patient is having pain or symptoms related to it, oftentimes a small chest tube has to be placed after the lung biopsy procedure. And this is designed to help evacuate the air from the space around your lung while that lung tissue heals up and that air leak resolves. Usually, if you have to have a chest tube placed, oftentimes you do end up spending a night in the hospital just for observation. And in the vast majority of cases, that chest tube can be removed the morning after the procedure, and you go home the next day. There are some chest tube devices that are designed for patients to go home with. So in some settings, With certain patients, if you have good family support and the pneumothorax seems small, there are devices that you can be sent home with, and then you follow up with your radiologist the next day for chest tube removal as an outpatient. But by and large, most patients do great. Most patients go home the same day. After the procedure, you're going to have a little bandage on the skin where the needle went in. These needles are quite small. It heals up very quickly. You can usually shower and bathe the next day without any sort of problems. Sometimes you can be a little sore after a lung biopsy, but it's usually not anything that requires any opioid medication or anything like that. Typically Tylenol or Motrin is sufficient to take care of pain after a lung biopsy procedure. You can resume most of your normal activities, almost immediately after a lung biopsy procedure. If anything, we usually tell folks to, take it easy for about a day just because of the sedation that you've had. And as far as results, the tissue is given directly to a pathologist who then has to make special slides with special stains. And this process just takes time. So usually we tell folks in about 3 to 5 business days, you'll have results from your biopsy.